What is a tracheostomy? It is an opening or hole in the neck that is created by a surgeon. The trachea or windpipe is the tube-shaped structure in the middle of the neck that connects the nose and mouth to the lungs. Tracheotomy is a procedure that creates an opening between the trachea and the skin. A tracheostomy bypasses breathing through the nose and mouth so the air can go straight through an opening in the neck. Tracheostomies have been documented throughout history, starting over 3,000 years ago. Why are tracheotomies needed? Tracheostomies bypass breathing through the nose and mouth so the patient can breathe better in emergencies and non-emergencies. Non-emergency tracheotomies are also called elective tracheotomies. Reasons for emergency tracheotomies include epiglottitis, supraglottitis, choking, anaphylaxis, large cancers blocking the upper airway, and trauma to the head and neck. Reasons for elective tracheotomies include head and neck cancer that doesn't block the upper airway, a floppy upper airway also called severe laryngomalacia, severe obstructive sleep apnea that cannot be controlled by other methods, health conditions that cause a tiny lower jaw such as Pierre-Robin sequence, a large tongue known as macroglossia, and patients with a breathing tube who cannot be weaned off of the machine. What are the steps of a tracheotomy? The patient lies down on the operating room table. Oxygen is given to the patient. General anesthesia is provided so the patient falls asleep. The patient is intubated by having a breathing tube placed. The tube is connected to the ventilator so the machine can breathe for the patient. The surgeon identifies and marks the airway structures of the neck. Local anesthetics are placed where the skin will be cut to help minimize any pain. A cut is made through the skin. The fat, muscles, and sometimes the thyroid gland will be cut and carefully moved away from the front of the trachea. An incision is made into the trachea near the second tracheal ring. The tracheostomy tube is then placed into the trachea. The cuff on the tube is inflated. The tube is connected to the ventilating machine, and the tracheostomy tube is secured to the patient using sutures and cotton ties. What are the potential complications after a tracheostomy? The tracheostomy tube could fall out of the airway, potential narrowing of the trachea over time, scar formation at the level of the skin, air could get trapped in the neck, air could get trapped between the lungs and the chest wall, also called a pneumothorax, bleeding, infection, and very rarely, death. Most tracheostomy tubes are plastic and some are metal. In general, there are three major categories to include cuffed tracheostomy tubes, which have balloons at the end to allow for the patient to be connected to a breathing machine, uncuffed tracheostomy tubes, and fenestrated tracheostomy tubes, which are tubes that have holes on the sides or the top. What happens after a tracheostomy? With a tracheostomy, the upper airway is no longer obstructed. Therefore, breathing should be dramatically improved. For patients on a ventilator, the amount of sedation can usually be reduced after the procedure. Care is needed to ensure that the tracheostomy tube stays in the airway and that the secretions are suctioned away, especially the first few weeks after surgery. Can patients speak after a tracheostomy? If patients are on a ventilator, then they cannot speak. However, once they are no longer on the ventilator, they should be able to speak by closing the tube's hole. Another alternative is to attach a tracheostomy speaking valve, also called a Passimier valve. Patients who are awake but cannot speak should be given a writing tablet so that they can communicate. After healing, the surgeon will instruct the patients on their diet. Some patients may need a swallow study before they start eating. Other patients may have a feeding tube placed in their nose or abdomen. Remember that only a healthcare provider can help you determine if a tracheostomy is needed based on your specific health condition. Your surgeon will review the risks, benefits, and alternatives with you so that you can decide if a tracheostomy is best for you. Lastly, the timing of when a tracheostomy can or should be removed needs to be discussed with your surgeon. In some cases, tracheostomies may need to be lifelong. The illustrations and content were created by Dr. Camacho.